Hello everyone, I'm back for another lesson. This is lesson number 5, and today I will be talking about bathing. So, bathing promotes health and well-being. Obviously you should bathe every day. However, for residents in a long-term care facility or residents in a hospital, they might have health problems or disabilities that restrict them from doing it themselves. So nursing assistants are a big part of our job is to keep our residents clean and promote their health and well-being. So bathing removes perspiration, dirt, oil, dead skin, dry skin, and it helps prevent odor and skin irritation. So bathing gives nursing assistants a great opportunity to observe the patient's skin carefully for discoloration, swelling, sores, and things like that. Discoloration is very important if you notice that, because discoloration, all it takes is a little pink or red mark to indicate signs of the beginning stages of a pressure ulcer, which if they go on for too long untreated or unnoticed, can be a serious problem. Pressure ulcers are very serious, and something, a little bit of redness or pink areas on the skin is something that should not be overlooked, especially on the pressure points of the body. So that's something to keep in mind when you are bathing. So patients may be given a bath or a shower depending on their preferences and their capability. Like I always say, you'll get to know your patient, so you'll figure out their likes and their dislikes and how they like to take baths or showers, how independent they are. You should always try to let them do something, so that way you're still maintaining that independence and that dignity that they need. So it's the whole mentality part. You want to give them a washcloth, let them wash their face while you wash their legs or something like that. Like, let them do what they can do and figure out what they can and cannot do. Maybe they might only need you to help them watch them, just to make sure that they're not bending too far down if they have back problems, or things like that. Just observe them, or you might have to do it all. So there are many different things that could be happening. So just to tell you guys a little bit of the steps of a bed bath. So of course, like always, you will have to identify yourself, identify them, provide privacy, adjust the bed, explain the procedure, provide privacy. I think I already said that. Gather your supplies, adjust the bed. I think I might have said that too. It's been a long night. So first thing you're going to want to do is place the bath blanket or the towel over the resident. So ask them to hold on to the top of it when you remove their gown or their clothes underneath. The reason for this is because you always want to keep a towel or a bath blanket over them at all times to keep up with the dignity factor. You want to make sure that they do not feel exposed, that they're not exposed. You want to keep them covered at all times, and when you're washing them, you're going to only reveal one thing at a time. So that way they don't feel like they're all laid out there and stuff like that. So you're going to get a basin. This is a bath basin. This is what a bath basin looks like. They're pretty big. I have supplies in here right now, but you can see they're pretty deep. So yeah, bath basins are pretty deep. Residents usually have them in their rooms. If not, you can find them in supply closets for CNAs, in any closets that they have around the facility, or they typically do have them in their rooms, but they might have personal items in them, so you might have to get a new one. They might only use it for soaking their feet or their hands or something like that, so you might, want to look into that before you start. So the water temperature should not be over 105 degrees Fahrenheit. Again, it's all about preference, but by the book, over 105 degrees Fahrenheit, the temperature should not be over. So warm water, I would make it at first make it more hot than warm, because depending on the size of the patient and their ability, you might, if the water's sitting here for a while, it's going to get cold. So if it's just barely warm can get cold by the time you're done. So considering you're working from head to toe, you don't want, them to be cold. So start off with warmer water, and then by the end, it'll be lukewarm. So you're going to apply your gloves. For just about everything, you need gloves. So that's no surprise. And then you're going to ask them what they are able to do, what they like to do, and things like that. And then, so like I said, you're only going to, like if you were washing my forearm, you would put a towel under me so that way you do not get the bed wet. If you're changing the bed, if you're changing the bed as well, then that's not as much of an issue. But if not, then you want to make sure you have that towel under there so that way you're not getting their bed wet. So yeah, and only expose one body part at a time, like I said. So you're going to wash, rinse, and dry one part of the body at a time. So for the face, you don't use soap. You can if it is their preference, but typically they don't like anything used on their face. So yeah, you can, you shouldn't wash the face with soap, but if they do like their face washed with soap, it's all about, again, finding out what they like and what they don't like. So that is something that you need to keep in mind. No soap on the face unless if they ask for it. Begin one eye at a time. Ask them to close their eyes. Tell them everything you're doing. Some other skills, maybe like denture care. If they're not in the room when you're doing it, you don't have to explain everything. But if they are, just tell them, hey, I'm going to be cleaning your dentures. Is that all right? But when it's something like this, when you're actually working on them, you want to make sure you're explaining every single thing that you do. Say, okay, I'm going to wash your eyes now. I'm going to wash behind your ears. I'm going to wash your chest now. You want to tell them everything that you're doing. That way they know what's happening. You don't just pull off their bath blanket and reveal their chest. You have to let them know, because you wouldn't want someone doing that to you. So they deserve the same respect, and that is part of their residents' rights. So you have to keep that in mind. So one body part at a time, obviously you have to do the back and the perineal area. So when you're doing the back, they will turn over. You could do it on the side. If they are able to lay flat on their stomach, they could. However, if the bed is not clean, you do not want a clean front side on a dirty bed. So it's better to just have them turn to one side. You should be giving bed baths with someone else, especially if you're a CNA, and maybe you're newer at the facility. But so for the perineal area, it's different for a male and a female. So for a female, using water and a small amount of soap, you will wash the perineal area from front to back using single strokes. So I do not have a washcloth with me, but I have a stocking. So I'm just going to show you the washcloth. Say the washcloth is this long. You would put your hand like this, and then you would just wrap it up, and then you would take the bottom and you would tuck it in the top. So your washcloth would be like this. It would be wrapped around your hand, and you wipe using single strokes from front to back. So you're going cleanest area to dirtiest area, straight down the perineal area. Perineal area means the private area. So again, this is something very personal. Make sure you're talking to them the whole time. So you have to make sure to get inside folds of the vagina and things like that. And for male residents, you want to make sure if they are uncircumcised, you want to make sure that you pull down the shaft of the penis and you clean around it. And same thing with the groin. You just want to make sure you're getting every area. And again, this is something very personal to the patient, so make sure you're talking to them the whole time. Ask them if the water is warm. Ask them if they are comfortable, if they're cold. Make sure you're talking to them. And also at the same time, don't just talk about what you're doing. Also, maybe if they are a bigger patient, it's going to take you a little bit longer. So instead of just sitting there saying, okay, I'm washing your shoulders now, you could be like, oh, what's your favorite sports team? You want to build a relationship at the same time. So after you're done that, you're going to empty and rinse the basin. You can, typically you would at this point put lotion on them if they like. They usually have this in their bath basins, in their bedside tables. This is what a facility lotion would look like. They're small, individual, personal sized ones so that they know that's only for them. And yeah, so they might want their teeth brushed or their dentures taken care of. I have a pair of dentures in here and a toothbrush here. So just see what else you can do for them. See if there's anything else that they need done. If it's a male resident, ask them if they want to be shaved, and you can shave at the same time. Bathing is very important, and there are a lot of steps to doing it. But once you get the hang of it, and you've done it a couple times, you'll get used to it, you'll get more comfortable with it, and it'll be like second nature to you. Hopefully that's how all of these skills will be by the time you're done watching one of these videos. Hopefully you go and practice for yourself or try to teach yourself further information than I'm trying to teach you, and then hopefully once you get enough information, you are able to do it confidently. These are all skills that I know how to do, that I have personally done. I have washed male and female residents before. I've done partial baths before on male residents, but on female residents I've done full baths and showers. So I do know what I am doing, and it's just a little bit harder to explain because I'm not physically doing it. So with that being said, I hope you guys take this seriously, and don't forget to build a personal relationship, because this is very important. So, thank you.